I want to go and test these kids. I want to test them. Because now we have made it easy, now we can test and then take the student. All those who are positive, make sure they are treated, and these children will grow and they will become doctors, they will become politicians, they will grow old like me and be able to take our nation forward instead of us hiding these children. It's a shame on us.
The Ministry of Health has launched the national Munonye Find the Child HIV testing campaign for children and adolescents in the country that will be implemented within 6 months starting from April to September 2024. The campaign aims at early identification of infections, timely linkage on treatment and ensuring optimal treatment. Dr. Diana Atwine, the Permanent Secretary at the Ministry of Health, stressed the need for multi-sectoral approach in tackling HIV/AIDS in children and adolescents if the country is to meet the target of ending HIV/AIDS by 2030.
Munonye cannot work until we are able to find every mother who is pregnant and we test and make sure that every child who is born, we know, we are 100% sure that we are not releasing, we are not missing out of all those children. How do we bring in teachers? How do we bring in school nurses? Play a very big role, because if these children are in boarding school and they are sick, or they take their ARVs and they don't adhere, I know that there is this issue of stigma that, you know, parents don't want to, but I can assure you, if you bring on board nurses that are well trained and oriented, they can be a big force for us.
Dr. Robert Mutumba, Programs Manager at AIDS Control Program, Ministry of Health, noted that starting this year in October, children will transition to single tablets daily to improve on adherence to treatment.
And our children actually will be able to access a single tablet. And of course, that is the Abacava, Lamivudine, and DTG. We think that probably this will improve adherence to treatment, especially among children and adolescents. We know that pill burden is also an issue.
The chairperson of NAPO FANO, Dr. Stephen Waititi, says that HIV/AIDS is no longer a death sentence and it's everybody's responsibility to join hands against HIV/AIDS.
But if indeed you start medicine, then you'll be healthy and you will be able to live out your dreams. That was actually one of the reasons that made me decide to be open about my HIV status. Because I've been following medicine, ARV, since 1999. I wasn't doing so well actually until 2004 when I got access to free ARVs. Then started doing very well. And since then, now 20 years later, I can see at 71 almost, I'm doing very well. Now,
HIV self-testing is a way to reach more people with undiagnosed HIV, bringing services closer to where the people live and create demand for HIV testing. Zahara Abigaba, UBC News.